Good afternoon. My name is Karsten Roberts. I am an education clinical specialist at the Hospital of the University of Pennsylvania in Philadelphia, PA. It is an honor to present our abstract, Second Year Respiratory Therapy Students Increase Knowledge in a Tele-ICU Clinical Rotation as an editor's choice. None of the authors have conflicts of interest to report related to this presentation. To put our study into context, it is important to note that clinical rotations are central to the education RT students receive during their programs. Although the AARC does not have a specific requirement for the number of hours students are required to complete during school, we should understand that there has been a decrease in the number of clinical sites for a variety of reasons. During the COVID-19 pandemic, student rotations were limited or discontinued due to the risk of infection. At the same time, healthcare saw an increase in the use of telemedicine during the pandemic. Our institution installed RTs at the telemedicine ICU as a patient safety measure and to decrease the need for the RTs to enter the patient rooms unnecessarily. ERTs in the Tele-ICU are able to complete patient ventilator assessments as well as other quality improvement tasks. We hypothesized that a clinical rotation at a Tele-ICU would increase student knowledge of mechanical ventilation, telemedicine, and COVID-19. Our study was an IRB-approved collaboration between Gwynedd Mercy University, Westchester University, and Penn Medicine. Students completed 2 4-hour clinical days in our Tele-ICU suite. Students were with preceptors on day shift or evening shift, with preceptors that had approximately 6 to 9 months of experience monitoring ICU patients remotely. The therapists rounded on 320 ICU beds in 5 hospitals across the health system. Patient assessments and clinical emergencies were addressed in real time, and communication between interdisciplinary teams took place in person via various communication platforms that included text messages and voice over internet provider, as well as the remote monitoring system itself. Students evaluated their confidence and experience in mechanical ventilation management, telemedicine, ARDS, and COVID-19 using a Likert scale 1 through 10. At the end of the second day of clinicals, students completed a second survey assessing their knowledge in the same concepts. We used the Wilcoxon signed ranks test to compare the pre- and post-test clinical surveys. We reported categorical data as medians and interquartile ranges, and a p-value of less than 0.05 was considered significant. 33 out of 37 students completed surveys pre- and post-clinical rotation. Of those, 67% were female. 55% of the students reported prior knowledge of telemedicine, and 52% of students reported having observed interactions between respiratory therapists and the Tele-ICU suite prior to coming to the clinical rotations. Mean self-confidence in mechanical ventilation, assessing waveforms, and knowledge of ARDS increased significantly, all with a p-value of 0.001. Knowledge related to spontaneous breathing protocols, lung protective ventilation, patient care planning, and the use of data collection tools increased from the beginning of the rotation, with p-values ranging from 0.001 to 0.009. Students' self-confidence in interprofessional communication increased from a median 8.5 at the beginning of the clinical rotation to a median 9.5 at the end of the rotations, and a p-value of 0.03. Finally, students' ability to assess COVID-19 patients increased with a significance of 0.001. At the conclusion of our study, we found that students' knowledge and skills in assessing patients via remote monitoring increased in a Tele-ICU clinical rotation. Knowledge related to COVID-19 also increased with statistical significance. And with that, I would like to open up the floor for discussion. Thank you.